Good day everyone, welcome to Pharmacist channel. Please remember that this video is intended to provide a quick guide on the food supplement presented by a community pharmacist. And this video is not intended to cover a piece of comprehensive information on the subject being presented here. It is necessary to read the label and the leaflet of the product and the product container in relation to the manufacturer's recommended use. This is important because the product sources and how the product is packaged and made influence a variety of differences in each unique product. Also, it is important to remember that food supplements are not medicine and do not use it as such. It is not a replacement for your current medication. Before I start the video presentation, I would appreciate it very much if you can subscribe, like, and share to support my channel. Without further ado, let us begin the video presentation. The drug on review for today is reduced glutathione, or GSH. Please see the drug concentration and dosage form available in your nearest pharmacy. The recommended use by the manufacturers are: it is used as a food supplement, as an antioxidant, as a detoxifier, as an immune booster, as skin lightening agent, and as a male and female fertility booster. Based on the private laboratory study of glutathione, this has a tendency toward increased skin elasticity which was observed in reduced glutathione and oxidized glutathione compared to placebo. The private lab observed a significant reduction in the wrinkles of the test subjects. The recommended intake amount of glutathione is: for the adult oral intake, take 1 capsule daily or check the manufacturer's recommended amount if the product contains a higher or lower concentration than what we are discussing. Other results seen from the private laboratory sees that glutathione, taken 250 mg per day in both reduced and oxidized forms, influences skin properties. Both forms are well tolerated. Also, glutathione or GSH is the oxidized version of the naturally occurring and very important detoxification agent glutathione. When the oxidized form of glutathione or GSH is used in vivo or done in a living organism, GSH will not remain oxidized, but rather will be reduced back to GSH or the reduced form of glutathione. The recommended intake is to take it at night in 2 to 3 hours after the last meal or once before bedtime. Do not take it when you have the following conditions. For instance, if you have a liver problem or elevated liver enzymes, and if you have an allergy to glutathione or any of its ingredients. Glutathione is generally safe and well tolerated. However, the efficacy and long-term safety of either form have not been examined systematically. Additionally, like any other supplements, there are recorded common side effects. The examples are the following: severe itching, small, flat discolored spots on the surface of the skin, transient minute red spot on the skin, feeling of tiredness, having high levels of certain liver enzymes, and they have a laxative effect or facilitation of bowel evacuation. Follow these tips on storing glutathione. Store it in a cool, dry place and not in direct sunlight. Store at temperatures not exceeding 30 degrees centigrade. And make sure that you keep the product away from children. Other recommendations when taking glutathione: the oral reduced form of glutathione or GSH or the oxidized glutathione or the more stable GSH may be given 250 mg per day for 12 weeks. The 250 mg per day daily intake was based on the allowed dose limit by the Thai and Taiwanese FDA during this study. A similar study of oral reduced glutathione or GSH administration taken 500 mg per day also resulted in lightening of skin color when given for 4 weeks. The result gained by a private lab was studied on a small group of female participants. Additionally, here are the health and safety tips that you may want to remember again. Do not take it if you have a liver problem. Please read carefully the product insert or manufacturer's recommended use. The product comes in different forms, concentrations, and combinations. Hence, the frequency and the amount of intake could be different. Lastly, the information I have gathered serves as a guide only from different sources. Thank you for your time and listening to this video. Have a great day ahead of you. See you in my next video. Once again, remember that this is a food supplement and not a medicine. Do not replace your medication with it. If you need more information about this supplement, please visit your nearest pharmacy and talk to your pharmacist. And before I end this video, kindly check my YouTube channel, Pharmacist, for other videos. If you want to see my new video upload every week, please hit the notification bell and subscribe. See you again in my next video. Thank you.